Some of the people that I talked to that battled these chronic diseases have created community. Brad Power, back in episode 2, has created a community to help crowdsource solutions for treatment options when standard therapies have been exhausted. And I met Brad Power and I saw the spark for advocacy start to flicker and then turn to flame. And I watched him since do incredible things to help patients and their families find treatment options through the Cancer Hacker Lab. Take a listen about the origin story, about how we met and what he's doing now. We met at a conference at Harvard Business School about 7 years ago.
Harvard Medical School.
Yeah. It was very much an industry think tank at the time, discussing ways to bring, precision medicine from bench research to bedside for patient care. And, many of those in attendance, including myself, I guess we can consider as being, futurist. I mean, we talk about the innovation in the present value to patients, even though a lot of what's talked about, patients can't access. And there was a leader from a prominent Boston cancer research center talking about his institution, how they incorporate genetic insights from patient care from the very beginning, suggesting it's the standard and it's what makes them one of the best. And then you stepped up to the microphone to respond to him. Can you share what your condition was at the time, kind of what was your thinking in the moment, and what really motivated you to share your experience, not just with him, but with the entire room?
Yeah, so you have to picture like an amphitheater and with a couple of microphones in the aisles. This is like in Paper Chase, or something. Anyway, and yeah, so he made that statement, and I was being treated at his institution, and I was bald, was in the middle of chemotherapy for my lymphoma, and I'm sitting in the audience. He says, "We sequence all of our patients," and I'm sitting in the audience going, "No, you don't," because I've asked my oncologist 5 times to get my tissue sequenced, and it hasn't happened. And so I went up to the microphone and said, "I love your institution. I think it's a great institution. I'm sure what you said is exactly your intention and that you've said that. But I'm just going to tell you it's not happening at the front line because, here I am with my bald head from the chemotherapy, and I've asked my oncologist 5 times and it hasn't happened." And just to sort of tell the rest of that story was people like yourself then walked. I met half a dozen or 10 people saying, "Thank you for adding that dose of reality to this rah-rah convention of people that are promoting personalized medicine."
When we first spoke and you were on a podcast that I was doing at the time, the one thing that really stood out to me in talking to you is the perspective that you had on what happened. When we first spoke of your diagnosis, you said that your thought was, this is going to be something that will help me, which is incredibly empowering. Now, are you just like, everything in life is, half glass, half full? Because, of my life's journey, I have formed the mindset that what happens to us in life has to happen to either make you the person that you were meant to be, or it comes to prepare you for a purpose that only you can fulfill. You talk about how you arrived at that mindset and how it led you into doing what you're doing today.
Yeah, I have just a kind of unique personality that's, whether it's an engineering mindset that I inherited from my father or a philosophical mindset that I developed from playing cards. I play bridge, and when you play bridge, you're dealt a hand, and you play the hand of the best you can. And so you don't get to choose what the cards are that you're dealt. All you can do is play the hand that you're dealt and do the best you can with it. So it's sort of in my mindset, in my DNA, to look at stuff that happens, and if I can't control it, if I get a scan and it says I have disease, whatever, I can't control that, but I can control my reaction to it. So that's a flavor of the serenity prayer, if you know it, which is to just sort of accept the things you can't control, and then and not stress or worry about them, and then do what you can with the things that you're with the hand you're dealt. And
It was
I
my
was
mother's
dealt
kitchen growing up.
I was dealt cancer, and so you're dealt lemons make lemonade. So uh, I had an opportunity, and it was pretty much at that session that you were talking about, where all these people said, "You have a voice. There's something you can do here." I felt it was like a calling. It was something was telling me that this is what my purpose was. This is what I should do, and it hit me at a time of life where it built on things that I was doing and could do, and so I sort of followed it and made the lemonade from the lemons I was dealt. Given my biases, I'm all about thinking that people need more information. So if you're going to personalize care, you need data, and if you're going to get data, you need diagnostics. So maxing out on diagnostics is one of my pet beliefs, and so whether it's more liquid biopsies of different types, whether it's getting your tissue sequenced, um, it's always better to have more data, more information. And so that's something that I think patients should be asking their doctor, which is, are there any other tests that I could or should get that would help guide my care or identify other treatment options? Um, when it comes to um, that decision or treatment decisions, again, I'm focusing on testing and treatment decisions, asking your doctor if you can get a second opinion. Now, this, as you know, gets into a whole um, emotional, potentially, or political thing. Are you basically saying to your doctor that you don't trust them, you don't respect them, and that you need another opinion because you don't honor them? So there's just some like hesitancy that most people would have in asking for that. But it just makes sense that if you're going to be making one of the most important decisions in your life, that you would want more input to it. And a second opinion is good, and a third and a fourth and a fifth and a crowd is even better. So again, maxing out on additional perspectives on the decision that you're facing, and they can be not only from experts but from basically all walks of life. I come to this with no medical background, no biology background, and yet you're making trade-off decisions, and trade-off decisions are something that I do understand. Like I was suggesting, quality of life versus length of life, whether it's cost, uh, cost versus benefit. Whether you want to have therapies that might be a home run for you, might be have a path to being curative versus something that's tried and true and is reliable, but has serious side effects. Those are all trade-off decisions that are part of this process.
Kathy Baker founded My Faulty Gene and mygeneshare.org to share stories that can help reach and teach people about genetics and hereditary syndromes around the world. Take a listen as she talks about these organizations that she created and how genetic information saves lives and has created a community of patients, caregivers, and industry sponsors to help increase access to precision medicine.
I mean, he absolutely saved my life. Um, so when he gave me a reason to understand, I'm educated. I wouldn't have just ignored it. And this was pre Angelina Jolie effect, right? She had not come out at this point with her um, proactive surgeries. And so this was early still, 2009. And at the time, actually, my mom was about to pass from cancer. And so
Mm.
he just caught me at the right time. I said, sure, I'll test. My sister was also his patient, and she also tested. And we were both positive for a BRCA1 mutation. And unlike my sister had had a double mastectomy, and she had already had a total hysterectomy with bilateral salpingo oophorectomy, so she was not at risk like I was. When I had had my, breast cancer, I'd had lumpectomy, so I still had breast tissue,
Mhm.
and I still had my ovaries. So, knowing that, I promised my mom, and I waited until she passed 6 months later, and then I went forward with risk-reducing surgeries, and that's kind of, that was the point. I was just thinking, one and done. That's kind of what you think when you've had breast cancer, but it's so important for women to understand that have had breast cancer. Mine was 9 years later that I tested positive, and as it turns out, it was a life-saving catch for me because when I went forward with my risk-reducing surgeries, I did 10 hours of piggybacked surgeries at Baylor Hospital in Dallas, double mastectomy followed by complete, total breast reconstruction, and then total hysterectomy with bilateral salpingo oophorectomy, and uh-oh, I have early ovarian cancer.
Okay.
Nothing
Wow.
not totally unexpected, no one expected it.
Wow.
You know, when I talk about why do I do this, it always comes down to how could I not?
Yeah, gosh.
You know, how
Man,
could I
you
not?
inspire me, Kathy. You
How
really
I
do.
would not be here.
Yeah.
I look back when I share my story, which I do a lot of
Mhm.
speaking as a patient, and I show pictures of the things that I would have missed the last now 15 years. I would have missed the births of my grandchildren.
Yeah.
I wouldn't know them. They wouldn't know me. My kids wouldn't know they share my mutation, other family members. All of the things. I mean, I've done a lot of fun things in the last 15 years, but just imagine your own life, last 15 years. What would you have missed if you weren't here? So how can I not? I also uh, I spend all of our money on this, and I asked my husband, "Are you mad at me for doing it?" And he says, "No." Because
Yeah.
I'd rather have you and you wouldn't be here.
I always give a shout out to my followers on social media because it matters whether it is Instagram, Facebook, people engage with our content there. And I know this information is helpful for a number of people. And proof being through Instagram, Dan Dry Doc Shockley reached out to me via Instagram through a direct message. So again, like comment and send me DMs because I read and respond to those. And I learned about his story, which is truly fascinating. He has become a patient scientist. He was diagnosed with attenuated FAP, which is a colorectal cancer syndrome. And now he's on a mission to educate the next generation of doctors so people can survive this cancer syndrome. He learned from the father of hereditary cancer genetics, Dr. Henry Lynch himself. Dr. Lynch told Dan that he was the foremost expert on his condition, attenuated FAP. And this colorectal cancer condition is so rare that Dr. Lynch told Dan that 0.03003%, let me get that right, 0.003% of colorectal cancers are caused by this syndrome, attenuated FAP. And the reason is it's very hard to diagnose, or many clinicians don't know enough about it to make the diagnosis. And if left untreated, has a 100% chance of developing into colorectal cancer. Now Dan lectures and is does case presentations around the world to help physicians know how to diagnose and effectively treat attenuated FAP and other colorectal cancer syndromes. Let's listen to his powerful story about what he's doing to help the next generation of doctors and how he's continuing the legacy that Dr. Lynch placed upon him.
The late 60s, he was actually a medical doctor, a proctologist. So he had a lot of patients that were passing away of colon cancer. He suspected that colon cancer may not just be environmental, it may be hereditary. So he started applying for grants to do research, and they kept coming, turning them down, saying, Henry, you're way off. He goes, no, I think I'm on to something. And hey, Lynch syndrome's named after him. And in 1984, he received a grant from the American Cancer Society to conduct testing, which 6 years later led to the discovery of attenuated FAP being a subvariant of FAP. Now, he shared with me that he estimates that less than 0.03% of the global population were impacted by attenuated FAP. Now, that's what he shared with me personally. Now, let me go back to when I met him. So he came to Hawaii. He had one lecture at the University of Hawaii Cancer Center. So my genetic counselor um, invited me to one of his lectures. She had me go to Tripler Army Medical Center, and she had the chief um, hematologist on oncology doctor personally drive me down to the university, to the cancer center. So my genetic counselor was coming down a hallway with Dr. Lynch, and I was informed to walk ahead, and so she personally introduced me to Dr. Lynch in private before his lecture at the cancer center, and then afterwards we sat down. So an hour and 50 minutes is an hour and 50 minutes I will never forget. And I had my copy of my DNA test results, my pathology report, and we sat down and he said, well, Daniel, you have a unique case of AFAP. And I shared with him about he knew about the family history. There wasn't any. He goes, it's very well possible that your mutation started with you. And I said, well, I don't have any biological children, so it's going to end with me. And he said, well, I recommend you have your routine endoscopic surveillance. And if you'd like, you can send the pathology reports to me. I'll provide my feedback and insight. Just continue this as the years go on. And it was just amazing, to have this have an open door to Dr. Lynch. And so I realized that this diagnosis is rare, and it caught all my family off guard. I'm the youngest of my siblings, youngest of my first cousins. My parents and maternal, paternal relatives all passed away. So we have no idea, absolutely no idea, um, where this came from. So that was even more intriguing to me to continue to ask lots of questions. So, but having an open door with Dr. Lynch, through the years was just absolutely amazing, and the world renowned leader. And I was born in 1960, so when he passed away in June of 2019, my entire life up until that time, he has been devoted to hereditary cancer research. So I thought the least I can do is to educate the medical students about my journey. This way, they'll have it for the rest of their medical careers and the rest of their lives. And, I go back to my GI doctor was 70 years old when he performed my first and only colonoscopy. After my diagnosis and surgery, I had a follow up with him. And he says, Daniel, I was going to retire 6 years ago. And I said, why you didn't retire? Because you needed to save my life. And here, Dr. Lynch at the time was 86. Okay. So there's lots of things going on through the decades behind the scenes, no pun intended, with the GI community. And if it wasn't for my GI doctor attending these various conferences, I mean, how would he have suspected that this was FAP or AFAP? So immediately having me um, evaluated with genetic testing was brilliant. I mean, but it all goes back to what Dr. Lynch has been doing for the many decades prior to this. Um, that was that the GI community was able to pick up on this. And this way, this is where I come in to share my journey with the medical students, whether they're going to be cancer researchers, medical geneticists, cancer surgeons, even genetic counseling. This way, they have my information, and I do this. Virtually, I do it internationally. But this is my way to continue his legacy, to educate the medical students about attenuated FAP on the importance of early detection in hopes of saving lives. And, you know, it's just, this is the least that I can do. I look at that movie, it came out about 25 years ago called Pay It Forward. My life is like that. And I do everything gratis because I look at what Dr. Lynch has done. It's, saved my life. And then I was at Stanford as a patient 4 years ago because the mutation, there was a 3 centimeter adenoma in my jejunum, beginning of my small intestine, that is directly related to this mutation. And if left unattended, it could have reached my pancreas. So the VA referred me to Stanford University, which is where I have ties with now. So I had surgery, and I knew the older I got, once I met Dr. Lynch, that I would be a candidate for a surgery, which I thought was the Whipple procedure. However, in the last 25 years, there's a newer technology, and I had a pancreas sparing duodenectomy resection surgery. I know that's a lot to digest. So I had one of the nation's leading pancreatic surgeons at Stanford, and I had they removed 60 centimeters of my duodenum or duodenum, depends on who you talk to, what day of the week it is. They took my gallbladder out, and he inserted a 5 French pancreatic stent. And I continue to be asymptomatic. I'm fine. I've actually, since that surgery, I've actually gained 45 pounds, and that's just because I've always felt healthy. My endurance is a little slow, but that's okay. But I'm able to gain weight because I was down to like 145, 147 pounds. I feel great, and I'll be a patient at Stanford for the rest of my life, and with my genetic counselor Rachel, we stay in close contact with each other. But this is all part of the this mutation, the importance of early detection. So I was thankful and honored for the opportunity to meet Dr. Lynch, and so this way I can continue his legacy to you know educate the medical students, like I said before, about the importance of early detection, hopes of saving lives.
When I started out creating content for Genetics for Healthcare, one of the main motivations were to provide resources. There's information all over the place. And, a powerful statement was, and we're drowning in information. There's a lot of information, but there's also more noise. So we're not actually processing the information that's out there. It's just washing over us. So I wanted to make sure that our listeners knew credible resources backed by data where they can go and share information with their families or loved ones. And this includes having resources to help you have these conversations with your family and even children. When we learn that we have a genetic aberration or mutation that raises our risk, we have to build the courage to have these conversations with our family. And how in the world are you going to drop that awkward conversation during the family reunion or Thanksgiving dinner, right? So when a person gets a diagnosis, those that are close to them also receive a diagnosis, the siblings, the friends, the children, and there's ripples of effect that I didn't realize. But in talking to Brian Schertz in episode 20 and Ashley Dedman in episode 13, Brian Schertz created resources for kids through a comic book that shares how to talk to someone else about a cancer or hereditary syndrome. And then Ashley Dedman is doing incredible self advocacy work, helping women and others advocate for yourself. She made a decision because of her family history to have a preventative prophylactic mastectomy to avoid a cancer diagnosis. And how in the world do you explain this to your children? Well, she looked for resources to be able to do that. And then when she didn't find them, she created them. We're going to listen to Brian Schertz, and then we're going to take a listen to Ashley Dedman talk about the resources that they created to help communicate with the babes among us.
I learned of your website through a comic book.
Yeah.
Like just looking for resources. And it's a comic book that illustrates a woman whose sister received a cancer diagnosis, and that person received genetic testing, and it is a wonderful illustration of how real life, how we're affected by this, but by just having a little bit of knowledge and curiosity and then connecting with resources like Connect My Variant, this could be a watershed moment in your family's history to prevent disease going forward.
Absolutely. And so Mark Hicks and Caitlin Shirts put together that. Mark Hicks did the illustration, and Caitlin Shirts put together the text for that. And it's a great illustration of what can happen. And it illustrates something that I think when people realize, it helps them think more about hereditary disease as something that's a community thing, not just an individual thing. And that's the principle. When two people have the exact same mutation, there's a 90% chance they have a common ancestor. And when we introduce people to each other with their permission, then that opens doors. They're like, oh, this is my second, third, fourth cousin. I'm not sure how. And that forms that connection. It's a unique connection. And it also, we help them with their genealogy. We help them find out how they're related to each other. And it doesn't happen very often, but occasionally they can actually find out who that common ancestor is. When that happens, they know which parents, which great-grandparents, which great-great-grandparents sometimes have that mutation. They know which cousins and which second cousins are at risk and which cousins they don't have to talk to about. So it makes it a lot easier because there's a bunch of people you don't have to worry about. And there's some people who you know that are actually at higher risk than you thought they were before. And so you know who to talk to. You have somebody else who can help you talk with them, and it can be really powerful. We talk about it like the snowball growing. And you find two people that connect with each other, and then sometimes maybe they're fourth or fifth cousins. Then we find someone else who has the same mutation, who's a third cousin of one of them. And then someone else who has a mutation who's a second of the other one. And immediately they get tied into that family tree, and immediately they know which of their grandparents, which of their great-grandparents had it. Sometimes it answers questions about their family history they didn't know about before. And always it helps them realize, oh, these are the cousins I need to talk to. These are the people who are at risk. And it can really magnify. Once we saw a genetic counselor in Ohio finding two people with Lynch syndrome who were third cousins, and they found over 40 people who had the same mutation just from connecting those two individuals.
ConnectMyVariant.org. You guys deploy family outreach navigators to help that situation, to talk to someone that empowers them on how to talk about this. And you've developed evidence-based family connection protocols to help people identify other at-risk relatives and help those relatives to access genetic testing or genetic counseling at the least.
Yeah.
How can you share how your navigators connect with people? Like, how does someone come into your website or into the knowledge of the services that you offer and get them connected?
Yeah. So the service is designed for anyone who knows about hereditary cancer risk in their family. So that person who got diagnosed with cancer gets their genetic test, talks to their genetic counselor. Their genetic counselor says, go talk to your relatives. And they're like, okay, what do I do next? That's where we pick up. It's also for people who know about hereditary cancer in their family. They know that the gene, the mutation in their family, they might not have tested positive, but they're still interested in helping people. It could be the spouse of somebody, could be the brother or sister who tests negative. And they also want to be able to help their relatives. And so the Family Outreach Navigators and all the content on the website is designed so that somebody can have someone to go to and say, okay, what do I do next? Who do I talk to next? How do I talk to them? I feel awkward about talking to somebody about genetics. Can I role play with somebody? Can I figure out what scripts I can use to be able to talk to them better? Hopefully that person will receive a family letter from their genetic counselor. And they might have already actually reached out to their family members. Their family members say, yeah, I'm not really interested. And they're like, but I want to do something more. And how do I keep this conversation going? Because my family member isn't ready to get genetic testing now, but I know it's really important for them. And I know that down the line, they're going to thank me if I can help them get genetic testing. And most of the time, those people are going to test negative, and they're going to be like, okay, it's not something you have to worry about. But when they test positive, that can be something that's life-saving. Yeah. And so those family outreach navigators are there just to provide some support, to provide some ideas, and to help that person. And sometimes it takes one or two attempts. And so they're there over longitudinally, over 6 months or a year. Somebody can say this worked or didn't work, and they can come back to the family outreach navigators to help that. And then even better than family outreach navigators, for some of the variants, then we have somebody who actually has that mutation, who is what we call a variant champion. And then that person's going to be bringing that person in to talk to other people who have the same mutation, the same variant, and the same gene, and to help them share stories about how they work with that.
Tell us about those books, because I think they're phenomenal resources for people out there to know where they are and know where to get them. What inspired you to write those books?
So what inspired me was my personal experience and the gap in the resources. And as I shared earlier, I began my career as a health and PE teacher. And as I was going through my preventative double mastectomy, my oldest at the time was about 10 months old, and I found myself without the words of explaining to her why mommy couldn't pick her up, why she couldn't lay on mommy, why mommy just couldn't do certain things. And so I went online to try to find a book, and I knew that if I were to find a resource, it would be a resource that was linked to a cancer, right? Because typically you would find books around mastectomies when a woman has been diagnosed. I was not expecting to find a book about a undiagnosed woman having a mastectomy. So I even went to go look. I went to go look for those books, and I found a couple, but I did not find a book that at the time that reflect either a Black woman or women of color. And this was very disturbing for me because it was so important that my children see themselves reflected in books. And so I decided to write The Big Discovery, which is a tool to help all families have a conversation around a breast cancer diagnosis. And at the time, I decided to write the book with um, characters that reflect people of color. I can honestly say at the time, I wasn't as bold as I am in my advocacy as I was then. So I was very nervous about how a book with Black characters would be received. And so I was safe. I created characters that, again, were characters that were really any person could see themselves reflected, which I'm glad that I did. Um, but what I did in 2021, God laid it on my heart to republish my book with Black characters. And I knew I needed to be true to myself. And so I republished the book in 2021. And this time, like I said, I was more bold and more confident in my advocacy. And for me, it was important to not only create a book with Black characters, but to find an illustrator who could skillfully depict Black characters in a culturally unique way, which was amazing because my illustrator is not a person of color, but they have such an amazing eye for detail. And so I was super excited to work with her. So I relaunched in 2023, and this was to bridge the information gap and offer a culturally relevant resource to empower Black families and all families facing a breast cancer diagnosis. We have to acknowledge the disparities in breast cancer outcomes, especially for Black women who are at 41% more likely to die from this disease. And I believe that having tailored resources can empower families and communities to navigate this challenge together. Um, all of my books the forwards are written by doctors. So The Big Discovery is written by the forward was written by a surgical oncologist, my oncologist. And it also includes stories of Black mothers who've been diagnosed with breast cancer. It includes conversation starters, medically accurate images of breast screenings,
Mm.
um,
All for
Black,
kids.
all for kids, right? Because, Rome, what's going to happen is sometimes kids may or may not go to those appointments, but they're going to hear the words mammogram. They're going to hear the words malignant. They're going to hear these terms. And what I really wanted to do was to provide them with a child centric image and story to help them make the connections, right? And so my book features Black doctors because we know representation matters. It reflects Black navigators, patient navigators, Black genetic counselors, and other Black healthcare professionals. It also provides hand on activities so that families can have the conversation. So that's the big discovery. And then the big family trip, which I launched in October of last year, focuses on how to have family health conversations around a family health history, right? And so it takes place at a family reunion because that's typically where the time the entire family gets together. And we know in the Black community that family reunion is a staple for our community where we get together and we can hang out and just connect. And so that story talks about their kids and their parents are going to their mom's family reunion. And what they decided was that year they were going to have a set aside some time at the family reunion to sit down and talk about family health history, and have an activity where people who chose to participate could participate, and really empower the family to take this information back to their doctors, so that it could be able to help inform medical decisions. And so finally, I'll say, it was important for me to do this also because of the importance of not only representation, and discussing health topics, but also it's important because children who identify as Black, Indigenous, and people of color often encounter gaps in literacy. According to Our Kids Read, only 18% of Black children read on grade level. The Children's Book Council statistics indicate that only 13% of books feature Black characters. And so, for me, by providing educational resources that feature characters and professions that reflect the identities, and addressing these health topics, really can empower them and their families to engage in conversations more confidently.
Thank you for listening to this episode. Again, our mission is simply to empower you, to give you the language, to share stories, to be a light for someone else who is in the fight, looking for solutions to battle their disease, to get better, to be healed, to avoid and prevent disease. And hey, this content will live on. This content is evergreen and we'll build upon it as precision medicine grows. There's new genetic and genomic discoveries. There's new information about genes. We're going to be here updating it. So the most important thing that we do on the show is empowering others to advocate for themselves, to be a more effective advocate, to get the information they need to make informed shared treatment decisions with their care providers. So I'm going to allow some of these practical tips to play. I couldn't include everybody in the episode. I mean, we're already running long, so I appreciate you for listening. But we've got episode 1 with Steve Pickett, Kim Alexander, who is a patient advocate whose husband, Eli Alexander, was a former NFL linebacker who passed away. She's going to share practical advice for caregivers who are caring for someone and how to care for them and yourself. We've got Londi Maduro, who's a great example of how to advocate for someone else. She advocated for her father and her brother, and she shares a really powerful story there. Christine Ashcraft from episode 7 is going to talk about why you should be an advocate for your insurance companies who many times won't pay for these. And then we're going to hear again from Ashley Dedman from episode 13, because she just gave a powerful testimony of how she was an advocate for herself, not only for her care providers and her family, but also her insurance company to ensure that they were going to pay for the procedures and the testing and information that she needed to ensure her healthcare journey was secure. Take a listen.
When a doctor tells you you have a 70% chance of survival over a 5-year period, I said, well, I want to live longer than 5 years. So what does that mean? Tell me what that means. So ask questions that come into your head every single day in your health environment. Don't be afraid to ask. There are no silly questions whatsoever, because all you're asking for, you're seeking information to help you understand, comprehend. Doctors aren't going to know everything. Of course, I mean, my wife did not care for my urologist. The reason why she didn't care for my urologist because I loved him. He's a great guy, young urologist. He's from OU too, so we got along. But he would shrug his shoulders and say, "I don't know," and she thought that was incompetent. He goes, "How does he?" Because we're in a lane that he didn't know, and I appreciated that more than someone giving me some medical pablum of what the possibilities may be that I would never understand. I hope that answers your question about the questions you would ask, which are very simple and direct. Please tell me what I don't know in a manner in which I can know. That's the key.
Get comfortable with asking questions. Don't walk in and take whatever you're told at face value. As frightening as Google can be, sometimes it does help if it allows you to, be made aware of something you might not have known about. You just want to dig a little bit deeper. Be unapologetic about trying to get to the bottom of it. If something in your gut is telling you you're not getting the answers that you know and think you deserve. But I also feel like it's important to be aware of resources. There are so many more resources available to myeloma patients, and I'm sure cancer patients in general, with there being, Facebook groups and Instagram, so much on social media. I think it's really, really important to dig into those resources to get to the help that you need. One of the first things that I would suggest for patients and caregivers to advocate for themselves is to use your phone when you go in for your doctor's appointments and record the appointment. A lot of times when
That's
you get
big.
into a doctor's appointment, your mind is going in 50 million different directions. You may miss something. You may misunderstand something. The doctor may say something and you can't quite catch how he pronounced it. But if you record it, you can always go back later and listen to it, just like to be able to take notes. It's literally like the voice notes app on your iPhone if you have an iPhone, or I don't know why anybody wouldn't have anything but an iPhone. So to me, that's just like whatever you need to do to record it, just record unapologetically. Hey, doc, I'm getting ready to record this. I don't know why they would have any issue with you doing that. Secondly, definitely find out about local support groups. There are support groups in pretty much every market. That is huge. I just feel like support groups are instrumental in allowing you to connect with others who have already walked the walk or who may be step in step with what you're going through, and together you all can support each other. I think that's really, really important. The third thing would be, despite a diagnosis, which absolutely can be life altering, still make time to spend time together, make memories, take pictures, just do all kinds of things that allow you to escape, even if it is just for a little bit of time, in order to manage dealing with the weight of any type of diagnosis. It really is life altering. And you just have to be proactive in terms of not allowing it to beat you down. And I'll add a fourth: pray. Faith, I
Amen. Come on,
believe,
somebody.
is really,
Yes.
really important. Yeah, don't ever leave that.
My brother's 46 and he went for his physical, and the doctor told him he didn't need a PSA test. And my brother called me from the doctor's office because he's like, "What, are you sure? Well, do I need a digital rectal exam? Like what?" And the doctor's like, "No, we'll wait till you're 50." And he's like, "Well, I know I have a family history. My dad has prostate cancer and my uncle on my mom's side has prostate cancer. Can you please do this test?" And the doctor's like, "No, you don't need it." So then he calls me. He steps outside the office and calls me. And he's like, "Is this right?" And I said, "No, absolutely not. Like, I know they're telling people this now, but at least get a baseline because you've never had a test. And we know we have a family history, right?" So he's like, "Well, he said I don't need a digital rectal exam." I said, "They are going away from that, but at least get a PSA." The doctor heard him talking to me on the phone and came out and was like, "Who are you talking to?" And he was like, "My sister, she works in health. She's worked in healthcare. She did a documentary. She's very knowledgeable in prostate cancer. And she's telling me," and I'm like, "You tell that doctor," right? And so the doctor's like, "Well, if you really want it, I'll give it to you. I just feel it's unnecessary." This is why I really focus on advocacy and really speaking up for yourself. If I wasn't his sister, he would have just, oh, okay, well, if you say I don't need it, then I don't need it, right?
Yes,
But,
yes.
but because of the, the knowledge that I have in prostate cancer and the awareness my brother had with, this don't feel right, let me at least ask my sister. He was able to get his PSA test, he's fine, but now he knows his numbers. So when he
Yes.
goes back next year, if it's elevated, now we know we need to be concerned, right? And so advocacy, I cannot stress that enough. Just advocate for yourself with your physician. Learn as much as you can so you're not put in a position. Because let me tell you something, if he goes back 2 years from now when the doctor thinks he should have it, or 4 years because the doctor was telling him to wait till he's 50, then it's, oops, I'm sorry, sir, you have cancer. That's not going to hurt the doctor, it hurts you. So advocacy is the number one takeaway I want people to walk away from this conversation. Advocate for yourself.
Why do you think payers are not incorporating these insights to improve not only, healthcare outcomes, but the cost of care?
Um, to be frank, I think our incentives are disaligned in healthcare. When I first published a study back in 2015 and 2016, the first one showed a 39% reduction in emergency room, or rather hospitalization, 71% reduction in emergency room visits, saved over $1,100 per patient in 4 months. Followed up with a 52% reduction in readmissions, 42% reduction in ER visits, 85% drop in death in 60 days for people post hospitalization. I went into a health system and I said, hey, you should be doing this testing. And we have this great UScript clinical decision support that makes it easy right in your EHR. And they looked at me and they said, it's not that we don't want to do what's best for our patients, but we have this long list of must do's. And you do know the way that we make the most money is emergency room visits and hospitalizations. So, what happens if you go to the emergency room or the hospital and now you go to renew your health insurance with your employer and you cost a lot of money? What is the payer going to do? Increase the premiums. Where is the incentive to drive down emergency room visits and hospitalizations? This is why it is so important for patients to advocate for themselves.
Another thing is also understanding, not only with healthcare access, it's understanding how to be able how to navigate our health care. I know when I was going through my medical management and even my double mastectomy, I had to be an advocate to my health insurance. There were things that they did not know. So I had to equip myself with the policies in the legislation.
That is
Um,
huge.
it
That is
is.
so huge. Okay, I'm sorry. I didn't
It
mean to- Please say that again.
is.
I
No,
mean,
you're spot you're good, because what I realized is sometimes you're calling your health insurance and they're reading from a prompt. They're reading
ugh,
from the screen. If the patient says this,
ugh,
you say that, right? And
ugh.
I had to really advocate for myself. And it goes back to having great doctors, because my doctors, when I needed, and this is one example, I remember when I had my mastectomy, I had it in December. And that following March, my employer switched insurance companies. And so when I went in for reconstruction a couple of months later in early 2017, my doctor, reconstruction doctor who had started my surgery, was no longer in network. And so my insurance told me, you need to go to three other doctors within network. And I went to three doctors and all of them said, you're technically still under the knife, we will not touch you because technically, your mastectomy is still in progress, right? So insurance made me get three denial letters from those in-network doctors. And then I had to go back and get a note from my recon doctor that stated that my patient is still in active surgery, in a sense. Um, and then once I got those letters, insurance finally approved my reconstruction doctor at the in-network rate, right? But it was an emotional journey. It was back and forth. I just had a mastectomy. I did not have the energy to go
Yeah.
back and forth. And so you have to be an advocate. You have to educate the health and the insurers. And you just You have to. It's
Yes.
critical. I think the first thing, advocacy begins at home. I think it's having the open conversations. We can no longer live in the time where our business, keep our business, what stays, what happens at home stays at home, keep our business private. Yes, some information definitely should be kept within the household, but information around family health history and diseases and conditions, that information should be shared.
I've shared it. Yeah.
Um, we have to, and it's not a one-time conversation, it's an ongoing conversation. And it's not just cancer, it's diabetes, it's heart disease, all of mental health conditions that can run in families. I think that's important. That's where advocacy begins. And as a mother, the best information that I can give my children is their knowledge on their family health history. Rome, my genetic results are in my will. If I die
Mm.
today, my children are young, but that information is written into my will because I don't need an additional barrier for them as they go into the healthcare system, right? They're already Black women. I need them to know this genetic predisposition that I have and have it documented so that when they enter into the healthcare system as young women, they have their mother's results. That's the greatest gift that I can give them as it pertains to their health, right? I think
Wow.
another factor is um, we have to not only talk about these conditions, but remove the stigmas around these different conditions, right? I think it's important to create a space where people can, when we're talking about family health history, where they can talk openly about mental health conditions and other conditions in a safe environment and not feel shamed or any less than because they have or they're sharing this information. So I think it's talking about it. I think it's creating a safe space for them to talk about family health history. And then I think, and none of those that costs nothing, right? I want to acknowledge that um, that as a woman in this space, that there's certain access and privileges that I've been able and blessed to have, but those things cost nothing, right? And I think the last thing is our voice. Another thing that costs nothing is our voice. It's being able to, if you feel something is wrong or it's off, stand up, say something. If you go to the doctor and you don't receive equitable care, you don't receive just the decency of being identified as a human being and being treated as such, before you leave, you need to go to the administrative offices and file a complaint if something has been done to the point where it warrants that, right? Because what we can't do is continue to allow um, persons to be mistreated, regardless of how they identify, what they look like. Every person, regardless of of their ability, disability status, their gender identity, their sexual orientation, their diagnosis, their zip code, their income, every person deserves equitable, individualized care. And if you are receiving less than that, you need to say something. So those would be the three things that I would say. They cost nothing. And our voice is so powerful. I've had to use my voice so many times. That's why I speak truth to power. That's why I'm bold. That's why I'm confident in what I do, because our voice has power.
Thank you for listening. Tune in next week where we talk about all the things I learned from experts in the field around precision medicine, genetics, and genomics. Subscribe to this podcast, genetics4healthcare.com, to get new information comes out before it comes out anywhere else. Share this episode on whatever platform you're listening on and help us grow the show. Like it and give us a review. Hit 5 stars, please. 5 stars on no matter what platform you're on, and help us get this to more people who are looking for this valuable information. Thank you for joining us, and we'll see you back here next week.